Hello, my name is Tracy Hughes with Kern Medical Supply, and today we'll be going over the indications and usage of the Intensity 5000 TENS unit by Compass Health. Let's see what's in the box. You have one Intensity 500 unit. We have the electrode pads, two lead wires, the Intensity Quick Start Guide, and the instruction manual. Transcutaneous electrical nerve stimulation, or TENS, is a non-invasive drug-free method of controlling pain. The TENS unit uses tiny electrical impulses sent through the skin to nerves to modify your pain's perception. TENS units do not cure physiological problems, it only helps control the pain. Let's discuss how a TENS works. There's nothing magic about a TENS unit. It is intended to relieve pain. It sends comfortable impulses through the skin that stimulate the nerves. In many cases, this stimulation will reduce or eliminate the pain you feel. In many patients, the reduction of pain lasts 3 to 4 times longer than the treatment time. In others, pain is only modified when nerve stimulation occurs. You may wish to discuss this method of pain management with your doctor. Let's talk about the contraindications and warnings of using a TENS unit. If you are under the care of a physician, please consult them before using this device. Do not use this device if you have a cardiac pacemaker, implanted defibrillator, or other implanted metallic or electronic device. Such use could cause electric shock, burns, electrical interference, or death. Do not place electrode pads over open wounds. Do not place electrode pads over your chest. It may cause rhythm disturbance in your heart. And do not place electrode pads over your neck. This can cause muscle spasms resulting in airway closure. Your unit comes with a 9-volt battery, which is inserted in the rear compartment. We are now going to connect the lead wires to the electrode pads. Be sure to push them in completely so they are not showing any of the metal pins. Now we're going to connect the lead wires to the device. Make sure the device is powered off. This device has 2 channels, 2 electrode pads for each channel. You may choose to use one channel, or you can stimulate 2 areas with both channels. Let's discuss the electrodes. These are disposable and should be replaced before they start to lose their adhesive nature. Before applying the electrodes to your skin, you should wash your skin surface to remove excess oil, which will build up on the electrode pads and reduce the life of use. Then, you'll remove the electrodes and apply them firmly to the area being stimulated. Never try to apply or remove electrodes while the device is powered on. This will cause an uncomfortable electric shock. So this is where we're going to power on the device and select the therapy mode. There are 5 therapy modes to choose from. We have, the first one is burst, and you select that here by pressing the mode button. The second one is normal, pulse width modulation, pulse rate modulation, strength duration. I suggest starting out with normal, then testing it out with the other modes to see what works best for you. You can also manually adjust the pulse width and pulse rate with these knobs here. Moving the PW knob will decrease or increase the length of the stimulation time between pulses. Moving the PR knob will decrease or increase the length of time between the stimulation phase. There are 4 therapy times available: 15 minutes, 30 minutes, 60 minutes, or continuous. You adjust those here with this button, and you can toggle between the time selections. Your doctor will tell you what amount of time you should use the device.